So the next two gentlemen are pretty special to the whole epilepsy world and to our family. Dr. Moshe, our new friend here, is on the board of the ILAE, and aside from his many duties as an epileptologist and professor at Albert Einstein, he's taken an attachment to this event, which has been very supportive, and because of him, we have a very nice turnout. We also have Dr. Gary Mathern sitting in the back, who's about to come up. And Dr. Mathern has been supporting this event even before we had an event. We needed someone to give us that extra little push of encouragement and say, yes, you should do this, and that's what he did. So very instrumental in getting this event together. Oh boy, that's pretty much it. I'm going to ask Dr. Solomon Moshe and Dr. Gary Mathern to come up, and then
he wants to say something. Yes, he wants to say something.
Dr. Mathern is also very special to me because he's my surgeon, and now I'm almost 7 years seizure-free.
So, for me, it's the first time here. And when I walked this morning, my first reaction was, wow. And thank you, Lewis, for organizing a most amazing event of bringing together patients and doctors to talk. And one of the important messages that the International League Against Epilepsy, which is the oldest society helping people with epilepsy, is stand up with epilepsy. Stand up for epilepsy, because we need to stand up and fight for the disease that can affect us in so many ways. And we need to be able to stand up with one voice, because if everybody has a different voice, the people who control our destiny, i.e. governments, i.e. institutions that support us, they will hear noise. We need to have one voice. And the message is, epilepsy can affect us in more than one ways. Many of you have epilepsy or you may have somebody in your family that has epilepsy that's difficult to control. That's about 30%. About 70% people have epilepsy that is easy to control, and yet they don't want to talk about it. They're afraid to talk about it because there is a stigma, and in some parts of the world they say that you're crazy if you have diagnosis of having epilepsy. And as a result, we cannot get the encouragement from the governments to help us solve the riddle. And it's really a tremendous riddle. How do you help people who have few seizures? And how do you help people who have a lot of seizures? Totally different populations. And we need to address both. And some people who have a lot of seizures get a lot more attention, but we also have to take care of the person who has few seizures. And a very recent story was a little boy who was about 11 years old. His father is a scientist who came to ask me, to seek me for a second opinion. He was trying to decide if his son needed treatment, and he didn't want to put him on medication because he was afraid that the medication was going to hurt him. And besides, he has a benign condition. There is a condition that's called benign rhodotic epilepsy. And the kid has had several seizures, and I talked to the child, and he says, no, I'm fine. And I said, what happens when you go to sleep? Because most of the seizures happen when he's asleep. He says, I'm scared. I said, what? I'm scared. And I'm trying to find a place in my bed because I know if I sleep in a specific position, the seizure will not come. That's not the case. But he was not be able to verbalize his anxiety. He ended up taking medication and he's doing fine. And the medication did not change him. But the important thing is to talk to the person, to get the feeling of what they're saying. And we have to listen to our patients. We have to listen to everyone. Or sometimes we have to guess what they feel And that's from the experience. Now, I'm going to ask you something else. I want you to get rid of the electronic medical record. Do you know about that? The electronic medical record, where we don't pay any attention to the patients when we type in the computer. But our job is to talk to you guys and to hear. And what we hope is that if you come out with one strong voice, you will allow us to develop the means of helping people with few seizures, people with a lot of seizures, people who do not need medications, people who need to get incorporated in their lives, people to be able to drive, to get pregnant, to have kids, to have a normal life, because most people with epilepsy will be okay. And we're going to make a lot of other people better if we have the ways. And Dr. Mathern is going to tell you how he does all these wonderful things for the difficult to control seizures. So I'm just going to raise the point. And as you see, we're speaking with one voice, okay? We're going to make life better. Thank you so much.
Thank you, Dr. Moshe. So, you've heard this afternoon with various speakers the point that epilepsy is a little different. Well, epilepsy advocacy is also a little bit different. If you think about it, and the room across the way is a great example of it, the advocates for epilepsy are by and large the family members of. If you look at most of the nonprofit organizations, they are put together by people who's got a family member or a child with epilepsy, wherever it might be. So, unlike other diseases, there's no Michael J. Fox. There's no survivor of breast cancer or survivor of prostate cancer. There are people with epilepsy and their families, and it's their families that do the advocacy. And so, when we talk about advocacy for epilepsy, it's going to come from the family members. And the Levies are a great example of that kind of advocacy, because basically they came to me and said, we think there needs to be an event, and they could get it sponsored here and supported with like, absolutely, we need this. So the first point is advocacy begins with you, the people in this room and the family members thereof. Why do we need advocates? We need advocates because there's a long list of causes for epilepsy. And we don't have the cures for many of those, or know how to treat them, as we hear in the room today. So how do we get those cures? We get those cures through raising money and resources to do the research. Diseases that have funding attract the scientists. You attract the scientists, you attract the ideas generate research, the research leads to therapies, new cures, etc. That advocacy needs to also come from meetings just like this. And in fact, the challenge that I would lead is that meetings like this should be expanded. There should be an Epilepsy Awareness Day on the other side of the United States, in Florida, at the Disney property in Disney World. We need to have a more united voice and a larger voice. And that advocacy really should be as many places as we can. And so the advocates, which are you, are the machine to help put this together. So Phil Gatton, who was here earlier from the Epilepsy Foundation, here's the opportunity to go bend his ear. The Epilepsy Foundation is there's two organizations here today, the Epilepsy Foundation and the Cure organization, who are in a position to help provide the advocacy to put a meeting in different places around the United States to raise awareness. Raising awareness is critical. If you don't have a voice, you don't get heard. If you don't have a voice and get heard, you don't get the resources. The squeaky wheel gets the grease. And that's true in the multiple diseases, all advocating, trying to get their voice. We need our advocates, our family members, to come together and advocate. And by that advocation, that means to draw attention and resources. And it's only through drawing those resources resources that is going to be helpful in bringing families together. And it's bringing the families together and those resources, the family members now who really made a difference. Besides the Libbies and this meeting, I work with several family members. One, Seth Wahlberg, who's taken on the leadership of trying to find a cure for the Rasmussen syndromes. Monica Jones, who with her family is now to help create Brain Recovery Project. And in that room across the way, you see many families who are devoting their time, energy, and resources. We've got to have our advocacy. I would say that in the next 10 years, one of the major themes that we're going to see in epilepsy is how do our advocacy groups and our professionals come together with one voice. You heard Dr. Moshe say it. I think we need to move on to actually make it happen. Advocacy and bringing together our families and our nonprofits and our professionals under the same roof is really going to be a focus. And I think that focus is what we need to focus on in the coming next few years. How do we bring these voices together? How do we make the message? Dr. Moshe and I just returned from Japan, where we had an opportunity to meet with the Japanese Epilepsy Society. And we met with a member of their upper house of government. And we get the same message from place to place to place. Governments are willing to listen, but what they want from us is they want what it is that we can fund that will provide you with the biggest bang for the buck and return those things that we think epilepsy needs to move forward on, such as training and education and those kinds of things, which are all being taken seriously by the international organizations. But again, it needs your help as advocates. And as advocates, you will help get things done. And that means not only other people with epilepsy, but your neighbors and friends who all can be a part of it. It's through advocacy and getting attention that life will go forward. So advocacy, I think, is a key to moving forward in the future. So it's that kind of message that I think is very key from a meeting like this. And I think I will stand down and we'll take questions from anyone. So are there questions from the crowd? Anything? Questions?
One question that's not pertaining to what you were just speaking to, but there was talk today about how difficult it affects the female reproductive organs. Is there any research as to what it would do to the male reproductive organs or ability to reproduce without problems?
There is evidence that Depakote has an effect on sperm counts.
The research has not been adequately done. Now, we know that the majority of the people are going to be just fine. We know that. So if you need your medication, you need to take it. Maybe we need to be aware of what doses that we need to give, and that's what we are trying to address now. Because some of the work that's been done is to find medications for people who have difficult to control seizures, so we use very high doses. So probably we need to give much lower doses than that. And sometimes I joke saying that we have special populations to take care of. We have babies and children is a special population. Then the elderly, it's a special population. Then women. And sometimes I say, what happened to men? Okay? There is also a special population that we have to address. And so these studies are going to come and give us some information. But for the time being, with the appropriate doses, probably lower than they've been used, assuming that you have good seizure control, you should not be worried too much about it.
Thank you.
Other questions?
Do you know if there are any expos like this in the Midwest?
Any what?
If there's any meetings like this in the Midwest?
Right now, I don't know of any. But that doesn't mean that there aren't some. I believe that there are center in Chicago, and I know that, for example, at the Cleveland Clinic, they provide expos or areas in epilepsy care as well. Whether it involves something as broad as this, I do not know. Probably not. I think this is probably the broadest one I know of, representing multiple nonprofits all under the same roof.
What do we have to do to get it to other cities, like to Denver or to Chicago?
There needs to be someone on that site in those cities that are willing to help put this on. I mean, if you talk to Brad will tell you that organizing something like this is not that much work. It requires, though, people on the ground to find a site, to help organize some of the sponsors, and to help bring the organizations and community groups under one roof. So it takes the advocates, but once you have it, then I think it can happen. So it takes some sponsors.
And also to have the message, the same message. We don't want to go from one place to another with different messages. We cannot dilute that. So that's the most important thing, the message. Stand up for epilepsy with one voice and take care of the I'm just saying something, but one message.
Anybody else?
Yeah.
If
Can
not,
I just ask just a real dumb question about this? So, to understand how this happens, is it's just one spot in the brain starts and then it just like goes through the whole brain and shorts you out. Is that how these things happen? Is that how they take effect? When my daughter has it, is that what's happening to her? It just takes off in one spot, or is it a whole bunch of spots? Or does that make sense? My question even makes sense.
It does. And the assumption is that there is always a spot. Sometimes the spot is very large, sometimes the spot is very deep in the brain and may be hard to find. But we tend to believe that there is one spot in the brain, even if the seizure has bilateral manifestations. And that's part of the research that we've done the last few years, to try to persuade the people to understand that there is always one spot. Sometimes there may be two, but keep on looking for the one spot, because we have various ways of treating. Includes medicines, includes diet, includes surgery, includes alternative treatments that may be wonderful. We need to include also Eastern treatments sometimes, which we do not have much here, because improving your well-being, and it helps, and also making sure that the person is in the appropriate environment, that life is satisfactory to them. It takes money to do that. People with epilepsy deserve to be listened to and taken care of. And I don't think the governments are paying enough attention to this.
Thank you.
yeah, that last point is actually quite critical. You know, everyone has a story with epilepsy. During the Institute of Medicine's meetings, the committee made the comment that what they were most significantly impressed with were the individual patients' stories and the challenges that families and patients had to meet in their diagnosis and their treatment and finding the right care. The stories were sufficiently encompassing enough that a whole volume was put together just on those stories. So everyone has a story, and these stories do need to be collected so that people understand what it is that's involved with this. Yeah?
Sorry. Can I just say that this has been really wonderful today? We've learned more today than we have in the last 10 years of meeting with the neurologist. So thank you.
Thank Brad.
Don't make me cry. Nothing to say. You guys, you did it all.
You get the close.
Thank you, sir.
One more thing. You bring me here. I have to say one more thing. I always like to say something.
But
Please.
No, it's you guys.